The internet is absolutely buzzing about Trump's 2026 annual examination results. Keith Edwards, it's getting worse and it's spreading. MeidasTouch, major red flags surface in Trump's medical report. David Pakman, the Trump health scandal is growing fast. Harry Sisson, Trump health report leaks. It's terminal. Well, as promised, we will continue to be independent media's primary source of honest analysis relating to Trump's health, and today we will be reviewing Trump's full 2026 medical report. I've been an internal medicine and geriatrics specialist for 18 years, treating patients just like the president and reading reports just like this. This report contains much more information about Trump's health status than previous reports, but there are also several major omissions. We'll go over these today. And I'm pretty sure I found evidence that somebody in the White House has been watching this YouTube channel, the United Front Show, and my coverage of Trump's health. I'll show you that evidence as well in just a little bit. I also want to acknowledge the many observers who believe these medical reports are lies and that anything that comes out of the White House is a lie. There are even calls for the White House doctors to lose their medical licenses. I acknowledge that some of what is in this report is fabricated. We know for certain that his height and weight are lies, but those are vanity measurements. And as far as the rest of the measurable results in this report, I'm going to analyze those as if they are true, and these results may very well be true. I have a video coming in the next few days about Trump's health, what's fact and what's fiction, and Trump's most dangerous diagnosis, which the media isn't covering, but they should be. Be sure to subscribe, and with the new YouTube algorithm, you'll also need to click the bell icon, or that video may not find you. So let's get to the analysis of the 2026 medical report. And I'm going to start with an omission, and it's a big one. The most glaring omission from this medical report, and it's one of the absolute most basic parts of a report like this, it's the diagnosis list, sometimes called the active problem list. What are Trump's diagnoses? It should be on a report like this. A few days ago, I did a full review of Trump's medical chart and found 18 diagnoses. And since the White House doctors omitted it in this report, I'll put his active problem list on screen. The confirmed diagnoses, the ones that have been publicly released by his doctors over the years are, as I reviewed previously, hypercholesterolemia, obesity, chronic venous insufficiency, rosacea, diverticulosis, colon polyps, actinic keratosis, hair loss, and allergies. The unconfirmed or the unofficial diagnoses, but the conditions that we can all easily observe for ourselves are insomnia, daytime hypersomnolence, senile purpura, bruising on his hands, sarcopenia, muscle wasting and muscle weakness, inappropriate diet, sedentary lifestyle. Yes, those are specific medical diagnoses. Narcissistic personality disorder, fecal incontinence, and the question of dementia. Some kind of dementia, even if it's just age-appropriate dementia. This list should have been documented in this medical report, and it wasn't, which obscures the medical facts of the case. This is a key omission. Okay, on to the report. The first paragraph is just an introduction, but what stands out to me, and this was never mentioned before, is that the diagnostic studies and the lab testing conducted over the past year involved consultations from 22 specialty providers. That is a huge number of specialists involved in a case this simple. with a medical report suggesting such benign findings. So what this tells me is that Captain Sean Barbabella is practicing extremely defensive medicine. He has the highest stakes patient on earth and one that loves to sue people. And to tell you the truth, I probably would do the same thing if I was Trump's White House doctor. So we're going to move on to the vital statistics at the beginning of this report. But first, for 18 years as an internist, I saw so many Medicare patients run into the same problem over and over again. They were simply on the wrong plan. They picked a plan because it looked great on TV, or they picked a plan because that's what their friend picked. That's why I partnered with Chapter. In a quick 20-minute phone call, Chapter walks you through all of your Medicare options, original Medicare, supplemental plans, Advantage, and Part D, and helps you find the right plan that actually fits your doctors, your prescriptions, and your budget. Seniors who work with Chapter save an average of $1,100 per year. I would not partner with a company that I didn't believe in. So I invite you to call 504-613-5925 and speak with a trusted Medicare advisor today. Okay, moving on to the vital signs, the vital statistics. So he's still listed at 6'3", although he did gain weight according to this report. He's up to 238 pounds. He was previously 224 pounds. Interestingly enough, 6'3", 238 pounds would put his BMI at 29.7, which is 0.3 of a point below what would qualify him for clinical obesity. As I said in the previous video, I have him more like 6'1", 265 at least, which would give him a BMI of 35, which is class 2 obesity. His resting heart rate increased a little bit to 73 beats per minute, up from 62. His blood pressure is very low, 105/71. Previously 128/74. There's speculation that these are awfully low blood pressure readings. I'll have more about that in that video coming in a few days about what's fact and what's fiction with Trump's health. Stay tuned for that. Let's move on to the examination and diagnostic summary. Eyes, head, ears, nose, throat, all normal. Neck examination, normal. They do comment on the ultrasound of the carotid arteries, which showed normal results. He likely has some stenosis, but the report itself was not provided. And by the way, this ultrasound probably was the ultrasound he had done of the carotid arteries in July of 2024, unless they repeated it. They didn't say explicitly, but he does likely have some age-appropriate stenosis, but they did not mention it. The pulmonary findings, normal, lungs were clear. They do comment on the CT angiography, the CAT scan of the chest, and that was done in October of 2025. As we've said before, that was reported as normal. On his cardiac examination, they comment immediately about the CT angiography again, which showed no arterial obstructions. His arteries in his heart are not clogged, according to the report. In addition, they also comment on this AI-enhanced EKG or ECG analysis, which estimated his cardiac age at 14 years younger than his chronological age, so about 65 years old. That AI analysis is measuring the raw digital voltage, looking for subtle subvisual signs of advanced cardiac aging, like micro-level fibrosis, slowed conduction, ventricular remodeling. And these are things that really most doctors wouldn't be able to pick up on, but the AI algorithms might be able to. Whether or not we believe it, we can't say. Additional testing reported was echocardiogram, looking at the heart pump, the squeeze of the heart muscle, which showed preserved ejection fraction. No percentage was given. It's usually given as a percentage ejection fraction. Overall cardiac function is normal and circulation to the extremities remains intact. The gastrointestinal abdominal exam was normal, which is a lie. On examination, he certainly would be obese, which should be commented there. Moving on to the extremities and musculoskeletal, slight lower leg swelling was noted with improvement from last year. Now, on last year's report, April 2025, no swelling was noted on examination, but I'll remind you that the swelling was first noticed by the press in June of 2025, so he seems like he might have developed this swelling between April and June of last year, which I believe is what prompted all of that advanced cardiac testing that he had, the CT scan and ultrasounds, echocardiogram, etc. Moving on to the neurological exam, a comprehensive neurological examination was demonstrated. I think we have a few exaggerations here as well. Normal mental status, intact cranial nerves, normal motor strength, sensation, reflexes, gait, and balance. His gait and balance don't seem that good, so I'm not sure if I believe that examination finding. And then, of course, he had his fourth cognitive assessment test. That's that MoCA test, Montreal Cognitive Assessment. And once again, they report that he scored a 30 out of 30. We've done videos about this before on how simple that test is. It's a dementia screening tool. And I'll remind you, a person needs to have fairly significant dementia to not get a passing score on that, which is at least 26 out of 30 correct. The dermatologic examination, the examination of the skin, they finally comment on the bruising on the back of his hands, ecchymoses, consistent with minor soft tissue irritation related to frequent handshaking in the setting of aspirin use. There's obviously been lots of speculation about the bruising on the back of his hands and what the cause of that is. I've talked about it before. I'll talk about it again in our video coming up in a few days about what's fact and what's fiction with Donald Trump's health. Moving on to the laboratory results, and this is where I think somebody at the White House may be watching our videos. In the video I released the day of his examination, just a few days back, I mentioned 3 specific lab tests that should be performed. Have a listen. As far as the bruising goes, we know that he's taking aspirin, and we certainly would expect a certain amount of bruising. But there's been no report of other coagulation studies, bleeding studies with this possible dementia, problems with sleep and mood. I would certainly love to see a vitamin D level. I'd like to see a homocysteine level as far as his cognitive function. Well, this report includes all 3 of those tests that I mentioned, and they had not been mentioned on any previous lab studies before. The coagulation studies and the vitamin D levels aren't that unusual, but to measure and report a homocysteine level, that is a very rare test used mostly in functional medicine, and most doctors don't even know about that test or what it portends. I think somebody in Washington is watching our videos. Glad to hear it. Let's take a look at the rest of the labs. The comprehensive laboratory evaluation, including a complete blood count. By the way, all these values were apparently normal limit values. A complete blood count, comprehensive metabolic panel, the coagulation profile, a D-dimer, which is a test for clots. So for those of you wishing clots and prayers, no clots last week. B-type natriuretic peptide, we'll talk about that in a minute, and cardiac biomarkers all remain within normal limits. The lipid panel, the total cholesterol 143, very close to what it was before. The triglyceride level 104, which is up from 56 previously. And the cholesterols, HDL cholesterol, the good one, once again, very high at 70, and the LDL cholesterol, the bad one, still very low at 53. There's been lots of comments about cholesterol levels that low. As I've mentioned before, he's taking 2 different cholesterol medications, probably higher dose Crestor, which we'll get to the medications in a minute, 20 milligram dose, which will drive the cholesterol down that low. Really, the question is, if his arteries are not clogging and his echocardiogram is normal, then why are we being so aggressive trying to treat this cholesterol and keep it down as low as it is? Or in other words, why don't they remove one of the medications and or lower the dosages of those medications? Hard to say. It's really up to them to make those determinations. In my practice, I certainly would eliminate medications when possible. The complete blood count, white blood cell count, is mostly unchanged, 4.9. The hemoglobin and hematocrit are a little bit lower, which the lower that goes, the more towards anemia he's going. But it's still within normal limits with the hematocrit at 40. The platelets are also normal at 202. The cardiac labs, the pro-BNP is 56. That's normal. That's a test for heart failure. In heart failure, when the heart muscle stretches, it releases this protein, and you can get some sense of the condition of the heart and status of heart failure based on how high that number is, although that number is quite low at 56. And the high sensitivity CRP is a measure of endothelial inflammation inside the blood vessels, especially of the heart. That's also normal at 1.05. Additional labs, the glucose normal again, as it was before, 83. The hemoglobin A1C test for diabetes, 5.2 previously, 5.3 this time, unchanged. Very surprised at that number. Is as good as it is based on his lifestyle and eating habits, exercise, etc. There's the homocysteine level at 14.6, which is normal. That's a protein that can accumulate in the bloodstream when there's a problem with methylation, a chemical reaction in the body. The higher that number is, the higher risk of problems like heart attacks and dementia. So normal there. The BUN, blood urea nitrogen, and creatinine, 20 and 0.8. Those are kidney function measurements. Those are normal. In fact, I might even make the argument that Trump was a little dehydrated the morning he had his blood drawn. The ALT and AST are liver enzymes. Those are normal. The vitamin B12 is lower than it was before, 355. Far as I'm concerned, that's too low. Normally, we like that number at least 400, if not better than that. There's the vitamin D level, which we asked for, and that was normal at 45. That's important for cognition and immune system health. The PSA, again, prostate-specific antigen, normal before, normal now. That's looking for prostate cancer. And the TSH, thyroid-stimulating hormone, is also normal. So there's certainly more lab results, more lab testing that was reported than had been done previously. They still haven't given us any of the Alzheimer's testing that they could have done. Again, easily available with blood tests. And again, if we believe these results, he seems to be in fairly good condition blood work-wise. Important to say that a person can have completely normal lab tests just like this. Virtually every lab result is within normal limits, just where we want it. A person could have significant cancer growing inside their body, and all of these tests may be normal. So just because your blood test results are perfect doesn't necessarily mean everything in your body is okay. It's a common mistake that people make when they get their blood results back and they get a good report. The doctor says all your labs are fine, and the person thinks, hey, everything's fine. I'll keep doing what I'm doing. No, not necessarily. So let's move on to the medication list just briefly. Again, some omissions here. They report the rosuvastatin, which is Crestor, and ezetimibe, which is Zetia. Those are both for cholesterol. They don't give the dosages, although it's likely 20 milligrams and 10 milligrams, I'm guessing, based on how low the cholesterol is. And then, of course, the aspirin. He's taking a full dose aspirin, which is essentially one over-the-counter adult aspirin every day, just like you might use for a headache. Normally, when we use cardiac prevention aspirin, we use a baby aspirin, which is an 81 milligram dose. You might hear people say he's taking 4 times the recommended dose. Well, he's using one adult aspirin every day. However, that one adult aspirin can give you the bruising on the back of the hands, or worsen it, I should say. What's not mentioned is the medications that he's used previously or what he's not taking. It's already been reported that he was taking Propecia for hair loss, Ambien for sleep. Again, I can't believe that they ever revealed that he actually took a medication like that, but his previous doctor, Ronnie Jackson, did report that. He was also previously on antibiotics, most likely doxycycline for his skin condition, rosacea, and the mometasone cream, the steroid cream, was previously listed and it's no longer listed, so perhaps he stopped using that. And then also the big question whether or not he is using Adderall. We'll never get a report from these doctors admitting that he takes a medication like Adderall. But as we know, Noel Kasler, the producer on The Apprentice, said that Trump used to take Adderall regularly to get himself amped up for his performances for the show. And there's significant speculation that Trump still uses Adderall from time to time to amp himself up for big speeches and things like that. The preventative care section, the president remains up to date on all blah, 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 blah. Skip that. Preventative counseling was provided, including guidance on diet, which he certainly will not heed. And they once again recommended that he take a low dose aspirin, the 81 milligram. And since he likes nice thin blood, as we've heard him say before, he'll probably continue using the full dose aspirin. Although I'm surprised he continues to use it, because the full dose aspirin is certainly making the bruising on the back of the hands worse, and he's getting scrutinized for that. So I'm surprised that he won't listen to his doctors and reduce the dosage of that aspirin. And they asked for him to continue to lose some weight. One important section, another omission here. There was no psychological examination commented on or performed, or it's missing from this report. That's the one we need, and probably the one we're never going to get. His narcissistic personality disorder is responsible for nearly all of his dangerous, corrupt, impulsive, manic, and erratic behaviors. I believe that doctors who understand this, like I do, have a duty to warn, and that is why I will continue to talk about his narcissistic personality disorder and the dangers of it. So in summary, President Trump remains in excellent health, strong cardiac, blah, 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 if you believe any of it. Bottom line, this report suggests that Trump is not going anywhere anytime soon, at least not for health reasons. We're going to have to beat Trump the old-fashioned way, the way the framers intended, at the ballot box. And thus, our most important fight before us is election integrity. Let's keep our eye on the ball and focus our attention where it should be, on this November 2026 election cycle. Thank you all for your support. Please subscribe and share this video on your socials. Thank you to our valued members. We appreciate you so very much. I'm over on Blue Sky. Come say hi to me there. Take care, and I'll see you in a few days.